So basically, first of all, thank you for being here, on both to our guest speakers, but also to everyone attending. On behalf of the IN-4-AHA Consortium, I think I'm always glad to see some familiar faces, but also some new faces in our webinars. The theme for today is about good practices, about finding, sharing good practices, sharing innovation, sharing knowledge with other stakeholders, and how we can use Futurium for that. We want to present also some selected good practices from our Good Practices Month. We'll be presenting 3 of them: the LOX Activate project, the Chronicon program, and Buenedad as well. So, but first, and because it is an important part of also of this webinar and kind of the dialogue we've been establishing with stakeholders throughout, we want to introduce Eric Lemon. He's a senior project manager at European Commission. And he will be talking to us a bit more about the Futurium platform, about what are the uses for this Futurium platform, and then of course showing us a bit more about how it works. Just to highlight 2 very quick things, for those who are joining in right now, this webinar is recorded. So if you're uncomfortable for any reason with video or audio, you can always shut it off and even ask questions in the chat room, and we'll then use the questions in the chat for the later Q&A. And also, the Q&A, the notes, the presentations, and the recording will be provided afterwards. So if you have to leave in the meantime, don't worry. If you signed up for the webinar, you will receive all of this information afterwards. So now, without further ado, Eric, the virtual stage is yours.
Okay, thank you very much. Hello, everybody. So I just shared in the conversation to all of you the address of Futurium website. This is a public website since long, but since 1 year, it's a new version of it. So we have some data. Oh, I will also share my screen probably later on or now. Sorry for that. I need to find out where I can share the screen.
I think it's down below. There's kind of a green button.
Oh, yeah, exactly. So this is the one that I need to find. Okay. Which screen to share to you? Okay, this one. Probably you will see it. Do you?
Yeah, we're seeing it.
The big one with 2 windows there?
It's 2 windows.
Okay, perfect. So you would see on the right side, this is the homepage of Futurium. That website, I can give you some numbers of it. So it's for communities, basically. So it's a platform. It's a platform where you can see groups there in the menu. Okay, so you have some groups for different topics. All those groups are not created by anyone. It has to be accepted by us, but okay, when you're in, you have groups. And notably the one we created for, I think, your project, if I'm not wrong, the active and healthy living in the digital world. So this is the starting point. So that group, for example, you have with subgroups there is part of that platform, which is called Futurium. In the About page of Futurium, you have all the necessary explanation. If you want to read it, what is the history, how can you be involved in, you are free to do that. And also in the groups, I will share there is a specific groups that we built for newbies. And I will also share that in the conversation here. I need to find out again. What is the conversation?
And this will also be shared in a follow-up package. So we'll be sending all of these links as well for everyone to kind of join in.
What is the question? No.
No, this is not a question.
Okay.
It's just later we'll also be sharing the links. So for people who
want to
right now, it's okay, but they can do it also afterwards.
But those are the 2 ones that are interesting. And of course, we are focusing now to your community, I guess, which is that one, and all the subgroups. So what would it happen? Theoretically, anyone can go register to Futurium. Most of the people visit that themselves, okay? You can visit the content of all those groups. But if you want to comment some posts, whatever you want to do, you can. Let's say I take randomly some. It's just written here. You need to log in to post comments. So I'm already logged in here in the other side. It's the same situation. I go in your group. Okay, here I'm logging with my account. And you can see that if you are a member of the platform Futurium, you may be member of many groups. Like this is my profile with all my comments that I can see, and all the groups that I joined to discuss, including some private groups, by the way. So we have 60 groups within the platform, and among roughly 30,000 members that are there, and approximately 8,000 visitors a day in there. So how can you contribute there? It depends the rules of your community. Probably Claudio will explain you more about that. But basically, we have created subgroups in your community that are based on the thematics you want to be part of. So international comparison, for example, you may want to join that one. You would see here in place of, in my case, you would see here join the group. You would click in there and you would join it as a member. When you join it as a member, you can post yourself publication or just comment it or just read it and be part of the community. Voila, so that's the main thing. So how it would work, similarly to this, not exactly like this, but similarly, you would decide yourself, oh, do I post a library or not? You may not fill that one, a title, a comment, whatever you want, and save, and it's published. Published or not, it depends the moderation of the group. That I don't know. It's for the managers to decide. I cannot help you on that side, but mainly you have events and you have posts that are like here, best practice, library, forum, that are qualified by their typology. Like it is a break practice, it is a library post. Okay, events are something apart. And you can quickly filter out some specific tags in the lateral menu. Voilà, so this is all I can say, I think in 10 minutes, but maybe it's better to open a question already there, or Claudio to help me to see where I can help you.
Oh yeah, that would be the interesting part, because from our side, from the IN-4-AHA consortium side as well, we organized a Good Practices Month initiative where people would post their best practices on Futurium. But this is something that I wanted to open now. So what's
Já estás a começar a expulsar as pessoas de casa e mandar levar as garrafas e caralho.
Exatamente. Exatamente.
I don't know who is speaking that loudly. Sorry.
Nomes de empresas que fazem limpezas.
I don't know. It was kind of this loud voice, which I was not expecting to happen. I think it was someone here, but I think it's muted now. So as I was saying, the important part of it, from our best practices moment, from best practices month, was to be able to post these good practices and then be able to interact with them, or also to transition some of the good practices they had in the old repository here. So what I would open up now, and we can have around 5 or 10 minutes for this discussion, is for all the people who are here, what were your difficulties in uploading the best practices? What do you think are the problems right now in uploading or commenting through Futurium? Or if someone here, for example, hasn't heard a lot about Futurium and is only now hearing about it for the first time. So we wanted to know a bit more about what people think and who are here participating. So maybe I would open up for that. Whoever wants to comment, turn on your microphones and just talk with us about this.
Hi, hello. This is Irati from the Basque Country, from Cronigune. I would like to point out that we haven't had any problems to upload the good practice. It was so easy. So maybe there is any difficulty that you have to log in and you don't have your profile or your account. So maybe there can be any difficulty, but related to the best practice uploading, I haven't had it. And then I have to say that I have once I uploaded our good practices, I have reviewed them and I have made changes and everything was good. So from my side, I think that it's very easy, and we are also free to, we don't have to have a approval process. So it is easier for us to update this information, to upload new information related to any good practice. So from our side, I think that it is very easy, very attractive, very easy using, and so on. So I would like to point out that.
Okay, thanks, Irati. Juan Mario, do you want to add something?
Yeah, for us, it was also very easy to use it, but I have a suggestion to improve a little bit this area. Is that, in my opinion, it was not easy to have the list of all good practice, because this way of block or whatever, I don't know the name of the system, only allows the last post to be shown. And if you can improve it with a general list by issues or tags or I don't know what, maybe it can be a little bit better. But it was easy for us. Thank you.
Thanks, Juan Mario, for your feedback.
Can you answer to
that? Sorry, maybe, I mean, should I go in, Claudio?
Yeah, I think so. I think Eric wanted to add something, but would you prefer, Eric?
No, I want just to react to thank you, Juan Mario, for the feedback. Yes, indeed, it's like a simple blog, I would say. It's just chronological. It's not that database-like. What I know so far is that other groups that have the similar target, you may post good practice, but the editorial team will construct then some other specific pages with summarizing all the numbered best practice, because it's not a database, it's not that reference, and each post is supposed to be highly discussed. If you want to interact, I don't know if there are basically no comments in there, but it can be that with other groups we have much more people interacting, commenting each post. Okay, that's one thing, but the effort to summarize the best practice in a kind of number of classified way is probably another process. So because here we are just accommodating to most of the demand for all the groups that are completely different purposes, right? It needs to be simple. So the first thing is that I'm satisfied that I can hear that some people say, oh, that was easy. I'm a bit surprised because I still find it complex, but okay. And yes, it's a good suggestion, not saying that it's impossible to do it. So still okay for us to get a question and to see how we could eventually improve that later on. It may be that in the future, we would have lateral boxes, like you could filter out some other things, but it will not be intelligent sorting. If you want to analyze what any random people can post, you need to summarize it first in a page. That is possible, but that's another point. Thank you.
So Anna, you were saying as well?
Yeah, I just wanted to add that I agree that it's not very complicated to upload a summary of a best practice that you have. You can structure the information more or less. And I fully agree with Juan Mario that it is very important to be able to search for other good practices. So I don't know how this could evolve. Maybe I was thinking of the tags that are used, that you can start writing the tags for the specific post, and you may find the one that you want or not. So I don't know how advanced we can have a selection of that. And my other comment is that the categories that are within the active and healthy living in the digital world section of the Futurium, and sometimes it's difficult to find the best place to put an initiative because it's within ecosystems, or it's in the well-being one that is, I think, I don't know, but probably the first one is for health promotion, integrated care, and all those things are the basic place to put all those initiatives. So just to give another, I don't know how easy it is to change that, the different categories, but maybe, I mean, because if you have international ecosystem within your region, and the others are international cooperation. But if you have an ecosystem,
maybe it's not very intuitive.
In which one you or you post it twice? I don't know. You don't have. It's a difficulty. But I mean, the platform is very easy to use, and it's also having to be identified with your login. I chose to use a corporate login that we have for my unit, but then it's not Ana Carriazo, that maybe some people would identify things from Andalusia when they read my name, but I don't know. It's complex when you want to identify something by the person who posted the specific initiative.
So it would be important to have kind of like an organization level or a tag for
recommendations. Yes, recommendation for the way to upload things.
Can I answer also to this one?
Yeah.
Please.
I'm not sure. I have an example here on that. Not really. So it's possible that the manager. Okay, I found one. I will show you. Wait a minute. It's in another window, but doesn't matter. So this is another group, you see? I know some delays in the screen. So I'm in another group with news, and that text on the top is written by the editorial team, just explaining what under the news you could do. Okay, it's not probably really the case here. It's talking about subscribing the newsletter, but you can also say, just under each menu entry, you would give some short explanatory text that will guide a little bit the contributors. So that's one thing. So still about the classification and the quick search on the post, because that's also not that easy, yes, to search about the things. Tags is really crude stuff. Huh? It's working, but we have editor tags that you don't use yourself here. So group by group, subgroup by subgroup, you can define editor tags, so only the editors and the managers can define them, so that it will force a kind of the main menu entries that you would like to be exposed. And about the research on the search on specific best practice or whatever, that we are working on advanced search engine, you know, that will index the thing much more. And it will be possible then for us to code something that will provide you automatically, dynamically, the option that you expect to have based on the tags, for example, or something. Voila, so it's okay for me now. I think I answer.
Yeah, because also some of these suggestions, I think, also impact a bit on what we as the IN-4-AHA consortium can do in terms of moderating some of these spaces. So those are very important for us to also know. Now, because we're also kind of short on time, we're going to move on to the showcasing of the selected good practices during our Good Practices Month. And then we'll kind of pick up the conversation more about the sharing part of it, not so much about the FUTURIUM part of it. So it's going to be a bit more of a wider discussion on how we can share good practices. But first of all, just to give kind of an introduction, this initiative went from the 11th of June to the 11th of July. And the point here was to select some of the good practices that were uploaded to FUTURIUM with some criteria in mind that we developed as a consortium. This is not a selection of what is best, what is not best. It's just a selection of what good practices were interesting, were built, and were mature enough to be presented. To start off, I'm actually going to ask Juan Mario Lecumberri from LOX, from Iniciativa Social Integral, actually, with the LOX good practice, to present and to give us an overview of what they've been doing.
Thank you very much, Claudio. Firstly, I would like to say thanks for inviting us to join this event. I am very happy about the project of FUTURIUM. Okay, I will try to share with you in 5 minutes, 5 or 10 minutes, more 10 than 5, our journey. We are a home caring company here in Valencia, Spain. And since 2012, we work in some innovation projects at European level or local level, trying to improve the use of Internet of Things as a way to find solutions for the active and healthy aging. In this way, in 2017, we took part in a big long-scale pilot project. It's called Activate. And our role within the consortium, it was firstly to provide end users in order to set some pilots in the city. We cover 525 homes of older people living alone. We don't do it by ourselves. We share that task with 3 entities. But also, from our point of view, we were also interested in how to apply innovation, to how to create new services, how to create new jobs relating to the IoT AHA solutions, and how we can learn from this process. About that, we must say that as a home caring services, we are working for small town city councils around Valencia. We are not working directly with the Valencia City Council. We provide traditional home caring services as personal coach, training courses about caring and other activities. We have around 100 workers, 99% of them, they are women. We cover 500 caretakers, and we have a technical team of 5 social workers. And also we have a high interest in innovation solutions for caring. In the field of the innovation, as I said before, we took part in some European level. In 2012, we took part in a AAL project. Then we have this project called Activates. Also, we are participating at a local level in the municipality innovation call for social innovation, and at regional level also. And we used to make some like training or workshops for the small municipalities that we are working with. So about that, what are we doing? We work hard in all directions. For example, during the COVID time, we participate in the emergency plan of recovery in the city, and we were near to, because this was signed by all political parties at the municipality, we were near to cover 3,000 to jump from 500 homes to 5,000 homes. This failed. I will explain later why. And also we are involved in innovative public procurement activities because we think we can learn a lot from these new areas. In Valencia, they are starting now with this way of procurement. Also, we have an international dimension. We took part of the Activates Org Association, that it was made from some of the entities that took part in the consortium. We are also working to improve the private market capillarizing solutions from the engineering and innovative projects to the final users. And we are also working to develop new business models. So about that, the situation with the COVID was helping us to have an agreement with the municipality. But when the idea jumped from the innovation to the social services, we discovered that the social services, they were not allowed to understand the impact of the affordable solutions that we had been using during the COVID. The entities that we work with, with those families, we made also a survey to prove the interest of the use of a monitoring system in this case. but unfortunately, we found a lot of resistance, not in the innovation side, but in the social service side. I think this is one key point that must be solved in the future for all the entities running in the path of the innovation. Innovative public procurement. We are now finishing the map of early attention in innovative public procurement in the city of Valencia. It doesn't mean that this will allow us to have a better position than other entities, but the process I think is very interesting for us SME to be there and to learn from the process. As you can see, the solutions about monitoring people, it was RET7. And in public procurement, you know that you don't need to discover new things. You can apply things that exist, but allow them new solutions or to solve new problems. This was our idea. The Activate.org association I mentioned before allow us to share our international face in our small company. And about the private market, we succeed, and now we are covering 105 homes of families that they are paying a monthly fee for the use of the monitoring solutions. We have now some city councils, not in Valencia, but around Valencia, that they are interested. And in the next month, it seems we are going to deploy some small pilots, because the solution has interest for these municipalities. And about the business models, I would like to comment that in the path of the innovation, we discover that the Internet of Things allow us not just to continue doing our traditional services, but also to discover new places relating the business model. For example, we are planning now to act as consultants or consulting to other companies like us out from our territory. We don't want to give our competitors our knowledge, but for example, if some company about home caring from Madrid or from Barcelona or I don't know, Basque Country or whatever, they want to start working with the solutions that we spend years learning about them, they can contact us and we can act as consultants. About the next point, the monitoring system that we use within Activates, it consists in some sensors that it's don't need the older people to wear anything. There are remote sensors, put it on the wall, and now we are in the deployment for the market. We have these 105 families, and now we are going to the market with a campaign about that the next 100 users, they can have a special bonus if they want to prove the solution. This is an example of the communication we made in our social media. We learn the importance of being in the social media, and we spent some money and some campaigns. But at the end, what we discovered is that the social media, it didn't work as we expected, especially because the algorithms that Facebook and Twitter are using. I think most of you must know that if you want to share information between your social network and it's not paid, the algorithm reduces the amount of the people that you can contact. Only if you pay, that algorithm is open and your information is meeting more people. Okay. So our experience is that the Facebook or Twitter or whatever is not working as well as we expected, and we are thinking now more in the way to work. I think in English is mouth to we want people to test the solutions and invite them to share that knowledge with other people around them. Word to mouth or something.
Word to mouth, yeah.
Yeah, thank you. So we are moving forward, learning, still trying to share our solutions with the final users. We are thinking also about the Snowball strategy. For example, ask someone to ask another one that need to ask another one or to share the knowledge about the solutions. We are thinking also about other media like press or radio. TV is too expensive for our size of company. We are trying also to adapt new services, and we are searching for more projects, probably in Europe horizon, because starting working at European level, it was the heart of everything we made regarding innovation. So we learn a lot from other partners and from the experience of the projects. This is another way we used to communicate. This is the sensor you can see on the picture. And okay, conclusions. European projects are a great opportunity, especially for us, and I think for everybody moving in the field of active and healthy aging. We need to consolidate networks. We have to improve our participation in umbrella organizations like FUTURIUM, for example, and we are always learning. We try to participate in some accelerator programs from our municipality to have a better knowledge about what we need to improve innovation in a traditional company like us. Don't forget that we are doing traditional home care services, and we have a real intention to be there. And thank you very much. I don't know if there is possible to answer questions now or later. It depends on
after the presentation.
And thank you very much for your attention.
Thank you, Juan Mario. We'll have the questions at the end of the 3 presentations. Now I would pass on to Irati to present the Chronicon program. And sorry if I butchered your name. It's a different name from our side. So please,
don't worry.
Feel free.
I know it. Hi, good afternoon. Thank you to all for attending this webinar. Firstly, I would like to say that it is a pleasure for us to present this program, this good practice that has been implemented in our region. And with your permission, I'm going to turn off my camera because I'm having a bit of problems with the internet connection. So in order to avoid any problem, I prefer to do that. So I will share my screen. Okay. Can you see my screen?
Yeah, we can see it now.
Yeah, I'm going to put in presentation mode. Wait me a second, please. Sorry, I put it here in the eye. I don't know. Oh yeah. Now I will do it.
It's I think it's below.
It's there, yeah, but it's below. But I put here. I'm going to let me wait a moment, please.
No problem.
Sorry. Okay. While I'm sharing my screen, I have problems. It's there.
Okay.
You see, I know. Sorry. 1 minute.
No problem. No problem.
No.
Yeah, I think it's because you're sharing the only the Microsoft window. Maybe it's easier to share.
I know it. I know it. Sorry, because I've got there. Yeah, sorry. There. Other second.
Okay.
Now. Can you see it? Yeah.
Yeah,
okay.
We can see it now.
So as said, I'm Irati Reguerena. I work in Cronigune as project manager. This is the Institute for Health Service Research in the Basque Country. And today I'm going to present Chronicom program. First of all, I would like to highlight that in the recent years, Osakidetza, our Basque Health Service, is working very hard to develop a series of online sources to facilitate the citizen access to health services and improve their capacity to make decisions and manage their illness by empowerment programs and tools. In this case, the COVID-19 has been a leap in this direction. And a Chronicom program, it is this type of structured corporate on an offline empowerment program, which is which is focused to individual empowerment of multimorbid patients and or their caregivers. So which are the origins of this program? This was developed in CareWell European project, coordinated by Cronigune at the European level, and which was ended in 2017. So the aim of CareWell was to propose, implement, and validate new integrated care healthcare models for patients with multiple diseases by, for one side, improving coordination and communication between healthcare professionals, by designing different interventions and pathways, and in another side, promoting empowerment and monitoring of these patients by home care and follow-up, and then developing different self-management and knowledge program. In this case, Chronicom program was the educative program that was developed in the Basque Country pilot site, which started in 2015 and ended at the end of 2016. So, and how was created this program and which was the methodology? We have to say that it was a co-design process divided in two phases. At the beginning, we created a multidisciplinary team composed by healthcare professionals, especially nurses, who analyzed how was to be structured this program, analyze different content and materials, then created these educative materials and educational materials, and see how to make the follow-up of these patients. Once all the program was structured and all the materials were developed, all these materials were in a second phase, were revised and validated by patients, by themselves, and also their caregivers. The idea was to identify if there was any problem to understand the content, if the images that we used were appropriate to this type of patients, because the aim of the program was to empower these patients. And we have to take into account that normally these multimorbid patients are elderly people. So it was to be very adapted to this target and to them. So to have their validation, it was necessary to then to know that you will I don't know how to say it, that you will achieve the aim, that is empower these patients. Not so we can say that it was a co-creation process between healthcare professionals and end users. And what is about the project and the program? The program is carried out by each chronic patients and their caregivers by the reference nurse of each patient. It is structured in 4 seasons, 1 season per week, and then it is defined a reminder season 2 months later once the program has been finished. The idea is to, in this reminder season, is to reinforce everything that has been learned and adhered by this patient. So the duration, it depends of the patient. The idea is to have a 30 minutes season to explain everything and to carry out each season. And it is developed in the consultation, face-to-face, or in the patient home. And as said, it is who is in charge of that training and providing all the materials is the reference nurse of each patient. So it was as part of the program, it was defined a protocol of the program, and they were defined a general objective of the programs that the healthcare professional has to tackle. So the general objectives are assessment of the patient, identify and explain the prevalent diseases that has this type of patients, then review the treatment, then agree also some purposes and objectives, some changes that they have to make in order to have to have a better life or healthy habits, and finally self-monitoring of symptoms and warning signs that has this type of patients. So there were developed different materials that that are ready to these healthcare professionals to deliver these seasons. I have to say that all these materials are available in 2 languages, in Spanish and Basque. You know that in our country, in the Basque country, we've got another language, official language, that is Basque. So they are available, all materials in both languages. And professionals can take all these type of materials, some presentations and handout sheets about different diseases, prevalent diseases in these patients, such as what is to be a multimorbid patient, diabetes, chronic obstructive pulmonary disease, heart failure, hypertension, and others. Then there were developed and are available some self-monitoring sheets. So the patient himself or herself writes down different values that the reference nurse indicates that it is necessary to monitor their disease. And they say when they have to write down or when they have to monitor it. And finally, there are some videos available. They are like a summary, in a short way and in a very attractive way, and with some keywords. There are available some videos that this healthcare professional can use. And these are uploaded in YouTube account of Osakidetza and also in the official website of Osakidetza. So as part of the program, they were developed some general objectives and some activities that has to be carried out in each of the seasons. But here you have like a summary of, in general, in a whole the program, which are the activities that has to be carried out. First of all, the healthcare professional, it is important at the beginning to have a comprehensive assessment of the patient. The nurse has to know, has to gather information of the patient related to their family, social situation, state of mind, life habits, and others. So that can help a healthcare professional to carry out and to know better the patient and to see which are the problems, how to solve these problems, has to agree some purposes and have to make changes and have to empower them. Then they explain what is to be a multimorbid patient. This is like an activity that is defined. Then the idea is to explain which are the prevalent diseases of this patient. In this case, they will explain, imagine what is to be a multimorbid patient, and then if this patient has diabetes and hypertension and heart failure, they will focus in these other 3 diseases, and they will explain these diseases. Then they identify and explain, they review also the treatment, which medication they are taking, the calendar of the next appointment with the doctor or the nurse, and others. And this task or this activity they carry out in each season, for example. They will explain also which are the recommendations that they have to follow in order to have a healthy lifestyle habits. Then they will detect the areas for improvement. They will also, the healthcare professional, reinforce what the patient is doing well that it is very important to empower the patient. And then if there is any problem, they will sit together which is the best solutions to tackle this problem. And finally, they will follow up these self-control and self-care sheets that I have shown you before. So we can say that Chronicon is online because all these materials are available and downloadable in Osavide global platform, that is the electronic health record of our system of Osakidetza, where is all the information in this part. You can see there that it's all the information about each patient, and where the professional can download, can see which season or where is the program, if what is missing or what not. Everything is registered in this electronic healthcare record. And then for general people, general citizen, patient also, especially, all the materials are available in the official website of Osakidetza. They are free, they are open to everyone, and they are available in the School of Health. Well, and what's about? As said, this was developed in a European project. It was implemented in a pilot site, and then it was incorporated in the multimorbid pathway of Osakidetza. So it is part of the pathway, and now it is a corporate program. But and it has been implemented and it has been carried out by professionals. But in the last year, we have followed, because all the materials has been analyzed and reviewed again, and has been updated with different contents or information. Every 3 years, the idea is to have a meeting between all the professionals that participated in the development and analyze the content. If there is any something new that has to be included in the program or not. So in these meetings, the professionals said to us that it was necessary to include a new season targeted to the patient's main caregiver. So we started, this was in 2020, and we started developing the 5th season that was targeted to the main caregiver. So, and what was the aim? The aim was to empower caregivers with skills, tools to provide quality care, detect any overload in this people, and then acquire healthy self-care habits. So we have developed these materials. All the materials have the same line, style, and we also have developed a video, and we have structured this season. Has to be who is in charge of this season. In this case, is the reference nurse of this patient. Which is the length of the season, 50 minutes, and then which are the general objectives or activities that has to be carried out during the season. And where are we? As I said, that's not that it is not closed, the program. So it has been implemented and scaled up to all Osakidetza organizations, healthcare organizations. So we are making awareness of the program. We are still making awareness of the program because Osakidetza is very big. There are many healthcare professionals, and we have developed training materials for the healthcare professionals, so they know more about, they have to get a certificate, and they will, in order to say that they know about the program. Then we have developed all the materials for this new season, but the idea is to implement it. In September, we are expected to implement this new season and to be available all the materials in the electronic health record and also in the School of Health. Then Osakidetza is analyzing the possibility to carry out this program by video consulting tool. We carried out a pilot study in 2020 because of COVID-19, and we saw that it was very useful and that the patients were open to have this type of, to carry out the decisions by video consulting. And finally, we are analyzing the possibility to access to personalized chronic materials. As said, all the patients are different because they both different diseases. So the idea would be to personalize the materials to each patient through the personal health folder. And that's all. Thank you. Here you have the link to know more about the good practice in Futurium. And if you want to know more, please, I'm open to receive any email, to contact, please contact me.
Okay, thanks a lot, Irati. We'll be now jumping to Ana Maria Carriazo and the IN-4-AHA good practice, and then we'll have some discussion around these good practices. Ana, the
Yes,
stage is
thank
yours.
you, Claudio, and I'm delighted to be here with my other colleagues from Spain in participating in this way of how to upload and share the good practices, best practices that we have developed in our regions. In our case, is a situation from Andalusia. Let me, this one, compartir. I hope you can see my screen.
Yeah, you can see your screen.
No?
Yeah,
You can. It's in presentation mode, right?
Yeah.
Okay, excellent. So my name is Ana Carriazo, Ana Maria Carriazo. I work at the Regional Ministry of Health and Families of Andalusia. This is a collective initiative with many people behind it, and just broadcasting what has been done inside here. And it's a platform developed for fostering healthy aging through digital solutions. So I will give this brief. I will not expand too much in the presentation. So as you know, Andalusia is in the south of Spain, 8.5 million inhabitants. It's not that, I mean, there is a proportion of elderly people of 15.6%, but with a growing forecast of the number of people with in the older ages. So active and healthy aging has been a priority for the Commission with the European Innovation Partnership, also for the World Health Organization. And within this framework, in Buena Edad, in good age, that is the meaning of this platform, is the platform for the promotion of active and healthy aging in Andalusia. It's a common space that incorporates the basic pillars of healthy aging, that are health, security, and participation, that is in the PAC activities. And it includes also lifelong learning activities, opportunities. So its main aim is to facilitate the communication about elderly people, professionals, families, carers through internet, apps, emails, or all the different digital opportunities that we have now. I will go roughly because it is, as you may say, these are screenshots from the platform. It's open. You can register and get additional information, but it's available in Spanish, and some information is available in English and also in French, because we have a number of visitors living with us here in the south of Spain. So in the section of health, we include healthy nutrition, physical activity, emotional well-being, and healthcare, with a set of videos and information that can be reviewed by the people. The same for the security, and particularly for home security. That is very important because people like to stay at home, and the prevention of falls, accident at home, in the bathroom, in the kitchen, and safety in the environment. This is a list of the activities that people upload directly to the platform for sharing them. These are the last from this very recent, the last things updated. They upload basic information, biography, programs, or trekking routes to follow and to get together to promote the activities among this age group and I mean elderly people. There are more, of course, but it's, this is the screenshot of the latest activities uploaded in the platform. A very important part of the platform is the one regarding training that is focused both on the people and also on the professionals, and they have a full set of different learning activities in there. The overall target population are people over 55 in Andalusia, their families and carers. But not only the people, but also the professionals from the health services, the social services, sports services, educational services, and many and different others. And it includes lifelong learning training services and literacy platforms. In Andalusia, we have a specific platform promoting digital literacy among rural areas for towns of around 20,000 inhabitants. It's called Guadalinfo, and we have a specific agreement with them to promote en buena edad among these people and in rural areas as well. So for the development of the platform, it was co-created with a wide set of meetings in the 8 provinces that we have, with more than 800 people participating in provincial meetings, prioritizing their expectation with more than 1,000 expectations identified. Elderly people associations, professional associations, as well as people from the Andalusian School of Public Health and the different at the Regional Ministry of Health and the different delegations. With all these, there were sub-initial agreements on, because the initial idea of what was going to be offered to the people was not the same that the people wanted to have been offered, and they wanted to have the seal and the backup from the Ministry of Health, the Regional Ministry of Health in Andalusia, but also to understand in their way how to see the information. This is the logo by Guadalinfo. The agreement was signed in 2019. So this was an opportunity because it was funded by the ERD funds in the region and started in 2015 with the initial design of the platform. During a couple of years, there was a participatory design phase with these co-creating sessions throughout the region. And then in April 2019, the platform was launched. A very important step in the process of developing was the opportunity that we had to visit our colleagues in Scotland, thanks to the Touring Support Scheme developed after the second call of reference sites in 2000. And we were able to visit because they had a platform called Living It Up that was also for connecting people, uploading activities, promoting active and healthy aging that we were aware of. So we organized a visit to our colleagues in Scotland at the beginning of January. That was very important for the development, and how not only to see the good things that were done in Scotland and to learn from it, but also to learn from the things to avoid in the design and how to better connect with the people there in the region. So I think this is a great opportunity, and I'm connecting this with the opportunity of learning from Futurium about other activities and to match them when you are starting to develop a solution, a digital solution, to see if there is someone or there is somewhere that have a similar solution to the idea that you have in your own project. So the numbers at this moment, we have roughly about 136 users, different users accessing the platform. Through the, there is a specific app called Health Response that provides additional services with a smaller amount of people registered to that. But there are a number of messages that are sent. And these in the graph here at the bottom left side of the image, you can see the people registering. Till the middle of this year, they mainly register at the initial ages, but there are people registering even in the very old ages, because this is also a motive for them to interact with other colleagues and to get in connection with their families that are not exactly at the same place. During the COVID-19 pandemic and then the obligation to stay at home and avoid the concentration of people, a number of activities were developed to collect infographics to help people in collaboration with Guadalinfo, this network for fostering digital literacy, on physical exercise for older people, balanced diet or emotional well-being. And also we run a contest for micro stories on the effect of the quarantine on the people. And they're all published and on the website. And the last activity of the greatest impact that we are improving now is the connection with our regional radio and television broadcasting service. Is Canal Sur, is the official television of the Junta de Andalucía, and with a number of programs. There are a lot of people, mainly from the older ages, watching this TV channel, and they have include these activities from are connected with them, the Embuenedad platform regarding physical activity, other job. A lot of them connected with physical activity, but also broadcasting how to prevent the heat wave or everything. So there is a link to a short video here, but I think that you can look at it later because the presentation will be shared through the platform. And thank you. I remain at your disposal if you need any further information about the platform.
Well, thanks a lot, Anna. Now we're going to moving on to the Q&A side of it. I know that there has already been some Q&A in the chat, which is great. I would just have one question.
Yeah.
I'm just going to have one question for now because we're also not very long on time. But it is from your side, because some of your innovative practices were the result of transfers. I mean, what do you believe right now is still the best way to promote good practices? What are the problems that exist, but what are like the alternatives to those problems that you believe are good for sharing these good practices with the rest of the community, basically? Whoever wants to answer, it's totally free. Yeah, you can be Irati.
I can start. Yeah. For example, in our case, our good practice was developed, as I said, in a European project. And then we have the chance also to scale up and include this program in the multimorbid patient pathway in another European project to review also again the program to see if it has to be improved or not, and then to scale up in our region, in our system, health system. And nowadays, Cronigune is coordinating a joint action called Gate Care, where this program has been included in the Basque Country good practice, and the idea is to scale up or transfer to another European regions that are interested in this program. So I think that for one side, the European projects are a good opportunity to transfer, to knowledge exchange good practices. And then we've got this platform, FUTURIUM platform, that has the label of the European Commission, that does this help to promote or to exchange information, and different activities as you are organizing today, this type of webinars or training activities, that sometimes it is easier. We know that now we have to carry out by video conference or so on, but when we visit or we travel to know more about the good practice, that helped a lot to see in a real life how it's implementing. So I hope in the future we will carry out this type of training activities, but we've got an experience last year with Scotland, and we learned a lot about their video consultation program. And I know that in Osakidetza has been implemented some improvements related to that. So I think that this type of activities help a lot. And then to have it this European Commission label or help.
I don't know if Anna or Juan Mario or anyone else wants to add.
No, I fully agree with Irati, regarding the way you need to have a common platform, where to find inspirational examples. Having also the backup of the Commission, I think, is very important. I mean, the Commission cannot review all the practices and see this is good or this is bad, but at least it's somewhere that is hosted by the Commission, probably that, I don't know if we can advance in that area. And then having the opportunity to visit is very important. I mean, for us, it was, my colleagues in charge of developing the platform were very, very, very happy to be able to learn directly from the TV. Usually when we organize these visits, study visits, you try to concentrate. That is also an effort for the organization that is in charge of setting up the agenda and everything, but also it helps you to organize your own activities, because you keep going, but then you have to sit down and see what are we going to share, to comment, and in an interactive form that is very important as well. So there are ways to move forward. Hopefully we will be able to travel again in the near future, after the summer, probably, I don't know. But again, yeah, but having a common platform is I will say, is the initial point to start.
Juan Mario, if you want to add something.
Yeah, I agree. Platform, it's necessary, but also it's time to create a new level of diffusion to spread the information about the solutions, because until now, right now, we are just keeping the information within the territory of the experts. And if we want to capillarize the solutions, that it's our role, we want to take the solutions to the hand of the end users, we need the population to know what is going on. If the solutions are just on websites, there are dozens of projects that it's supposed to create new business models, but at the end of the projects, there is nothing going to the market. And if we want to succeed, we need to capillarize the solutions. And of course, our point of view, we are not administration, we are an SME, and it probably is different, but we are feeling the people on the street. You know what I mean? We move with the needs of the people.
This is actually a very interesting point. I was kind of thinking that we can go off a bit on that, because you talked about getting outside of the stakeholders and the traditional stakeholders and experts that are operating in this field of active and healthy aging, and you talked about getting that to end users. And I'll also even complement that with, I mean, effectively, FUTURIUM is now starting to be used for that. But we had a repository last year We didn't use it for a while because it was archived. So how did all of you find new ways to basically communicate and disseminate these good practices? What were the alternatives that you used?
I don't understand why are not some specific calls to allow people working in the administration to understand the benefits of the innovation. Because innovation is going in calls from innovative partners, that mean engineers or public administration, but in the side of the innovation, but it's not going to the practical services that they can use the benefits of some solutions. You know what I mean? And I never understand why the European Union is not creating some specific calls that will allow a professional from the social services, is our priority for us, to have a better understanding of the benefits of the innovation.
So you're thinking it's still a bit developer tech focused in a way? I don't know if Anna or Irati want to comment that a bit.
For example, we are participating now in the early map of needs about innovation in Valencia. But in the same meeting, I met people coming from social services that they are not able to understand what we are trying to do. Of course, we are a company, we want benefits, but we have ethical aspects. We have we participate in projects also to create benefits for free for the population, because we are small and we have a criteria. You know what I mean? We are not a big company. And in this way, sometimes I surprised that there is that gap within the administration.
Okay, I don't know if Anna or Irati want to add.
Yes. In relation what Juan Mario is saying, in our case, for example, the Basque Country is working so hard to improve the innovation, the research, and to make awareness in their population that this is happening. And so I don't know, I think that this is very important, and there is a big gap in this case. For example, we have uploaded in the FUTURIUM platform the information about our innovation hub, where all these smart SMBAs and so on have like an ecosystem and space in order to innovate, in order to go to the market, to have this support to go to the market. So this is a very important part, and I think that there is still a big gap in this related to innovation and citizen. That the products arrive to them, but they don't know what is the work that has been done to improve that. We have to make awareness that innovation is happening and we are creating things to better life, but that there is like this type of European projects. I know that, for example, our government launched some different news related to that. There are like a special day for innovation, and they talk about that, but the new efforts has to be done. I think so, in many parts.
I think we are in the path, and I mean that there is a growing need. And I think that innovation, and particularly social services, are very traditional in the way Mario is commenting. So it's not so easy to incorporate. And the administration also is an old-fashioned structure. So it has to evolve as well. But I think it cannot change very dramatically, but I think we are in the way of changing. It's probably it's not very politically correct to say that innovation is not working within some parts of the public services, but we will have to face that very quickly. And the new funds are dedicated to this specifically. So somebody will have to run more than others, probably Juan Mario. But that's the way it is, yeah.
I would just now open up to if we have any questions from our audience. If anyone wants to pose a question about the sharing of good practice, or even about this last topic that we're discussing, which is kind of the rhythm of innovation in several aspects in the public sector, and then of course in SMEs or other parts of stakeholders. But I don't know if anyone wants to add something, a comment or a provocation or a question. Most of you are muted, so if you want to add, you have to enable the microphone. Okay, if not, then I can have just one last provocation, which is we were talking about this idea of essentially public sector as a rhythm, private sector as another rhythm, and we kind of need to involve a lot of new stakeholders. So this always comes up about stakeholder involvement. So we need new people, SMEs, more companies, more technology parks. We need kind of different stakeholders to get into it. What is your perspective on this? Is this kind of a need right now? Is it something that we kind of want for variety's sake? What do you think about this, of bringing in new stakeholders to kind of solve these issues?
If I may, and I think what Juan Mario will say this to Irati, I think also citizens and users in general. I mean, not only SMEs, not only the public administration, but also there is a demand from the users or the people living at home that need security, need easy access to the services where they are. They don't want to go or they don't need to go. And the technology is allowing this. And we have to adapt to that. I think it will come. I mean, I'm positive about that. But the involvement, probably just the thing is that associations of, in the case of active and healthy aging, that are elderly people association, there are a lot of them. They are very active, but they are active in our own language. They don't comment on speaking in English or something like that, but they are very active in our own territories. And we will see a movement in that. I think that is coming. We better be ready and prepared for that.
Yeah.
Yes, very, very close to Anna was saying. I think that you have mentioned end users and citizen. And I think sometimes when we start in a project, we start developing something, we don't include them at the beginning of the process. And I think that if we are going to develop something, we are going to think about any solution to them, they have to be at the beginning. So because we are going to see their necessities, we are going to see how to develop and adapt them. And I think that then the results are going to be better and the scale up also. So I think that it is very difficult because it is something related to the shared decision making also between patients and professionals. And this is the same. It's like what they want, they don't have the knowledge. Why they have to be at the beginning, not? But maybe it's necessary and we have to change the paradigm and change the culture. So start changing. So I think that, and then I think that it's important to know what is your ecosystem to include this quadruple helix that was important to the IN-4-AHA and reference site. But you have to have a very good, the map in your mind while you are going to start implementing something or start developing something. So in our case, for example, the hub give us the chance to include all these parts. So there is like a platform in the Basque Country where they know about where to go or where to ask or what to develop. So I think that this type of things can help. And also I think that this type of associations like IN-4-AHA, that I think that has helped a lot to all the stakeholders to make networking, to contacts and so on, to develop different projects, to develop different products. And now we've got the opportunity with IN-4-AHA. So we have to encourage, we have to promote this type of at the European level, and then to have the support of the European Commission, that is very important.
Happily, we are in our city, we are always interested about innovation. And I must say that in the city of Valencia, the innovation from the municipality is working so fine. They are generating new speech and they are always thinking. And it's funny because Irati was mentioned the innovation helix. This was something we learned from the municipality. And as you know, the innovation helix is made by the academia, that means university and knowledge centers, the administration, the enterprise, and the citizenship, that can be individuals or can be associations. But now in Valencia, the innovation, it's adding the fifth part of the helix. That means communication. So they understood that doesn't matter if you have the academia, the enterprise, the local administration, and the citizenship, if you don't have a good communication, innovation is not going on. And this is something I would like to share with you. Communication is one of the key of the innovation by now. Probably in the future, it will be not necessary, but now communication for us is the key. One of the key.
Thanks a lot as well. I think it's about time we close down this this webinar. It's very interesting because we went from this course of talking about the good practices, then talking about some specifics about sharing good practice, and then we kind of pivoted into the people first, people at the center of it, individuals at the center of it. There was also a few very interesting topics that were lifted in the chat room, and we'll of course be picking these up. We'll be having a few notes from this Q&A and have some conclusions from it, and then we'll of course be sharing it to all of those who participated here today. Thanks a lot for those who participated. Thanks a lot for our guest speakers as well, who've been here, giving us our insight, their expertise. That's very, very important. One last thing, we'll be giving that follow-up package over in the next few days. And we actually have another webinar to close off the summer next week about impact assessment and impact evaluation. So that would also be interesting for those who are interested on that topic. It's at the same time, Friday, 3 p.m. CET. And then, of course, after the summer, we'll be continuing with the webinars and the workshops with your feedback, with also the feedback that we've been gathering from stakeholders, so we can, of course, keep having these conversations, keep having this dialogue. So once again, thanks a lot. And of course, if there's anything you need from the IN-4-AHA Consortium, from us as University of Porto, or for any of the guests, please do get in touch with us so we can help. So thanks a lot once again. Bye-bye, everyone, and we'll keep in touch. Okay?
Thank you. It has been a pleasure.
Bye-bye.
Have a nice weekend. Bye.
Thank you very much. Bye-bye.